Hello.
Hi.
I'm Mike, your doctor. Are you Andrey?
Yeah.
Okay, Andrey. What's the reason of the visit?
Well, I've been having some pain in my palm.
So what's your name?
Andrey. Lossov.
Age?
17.
Height?
5. 10.
Do you know your weight?
No.
Let's get you up then.
Okay.
Just step on the scale.
Okay.
Let's see. £186. Okay. Stop playing with my scale. Sit down. So, have you had any of the following symptoms, like blood in your stool?
No.
No. Diarrhea?
A little bit of that. Lately.
Frequent gas pains?
Yeah, I've had some gas pains.
Okay. What about weight loss?
No weight loss.
Any vomiting for the past couple of days?
Yeah, I've been vomiting periodically.
Well, I think we're gonna test you for colon cancer because you have some of the symptoms. Not to get you worried, but I want to get yourself tested.
I understand.
Just take this and ask the nurse what she wants to do. Thank you.
Thanks.
Metastasis, cancer cells that have spread to one or more sites elsewhere in the body, often by the way of lymph system or bloodstream.
Malignant tumors. Cancer is dangerous and likely to cause death if untreated. Benign tumors, not cancerous, the opposite of malignant.
Here you go.
Carcinogens, any substance that causes cancer or help cancer grow, for example, tobacco.
Oncologist is a doctor with special training in the diagnosis and treatment of cancer.
Cruciferous vegetables are vegetables that contain antioxidants that help prevent cancer. Phytochemicals are non-nutritive plant chemicals that have protective or disease-preventive properties.
Well, Andrey.
Hi.
I'm Cody, I'm the male nurse here.
Nice to meet you.
Alright, so you're going to be tested for colon cancer, correct? Alright, so the test, it's a physical exam history, an exam of the body to check general signs of your health and stuff, including like checking for the disease such as lumps or anything else that seems unusual. Is there any history of cancer in your family?
Well, my grandpa had colon cancer.
Anyone else or that is? Alright, Alright, so a history of like a patient's like ancestors having like cancer like this, it usually helps out a lot because it can help us test you easier. So the digital rectal exam, it's an exam of the rectum. The doctor or nurse, not me, will insert a lubricated glove into the rectum to feel for lumps or anything else that seems unusual. The fecal octal blood test, it's a test to check the stool solid waste, like crap, for blood that can only be seen with a microscope. Alright, so small samples of your solid waste will be placed on special cards and returned to the doctor or laboratory testing. The barium enema, it's a series of x-rays of the lower gastrointestinal tract. A liquid that contains a silver white metallic compound is put into your rectum. The barium, here you go. The barium coats the lower gastrointestinal tract and the x-rays are taken. The procedure is also called a lower GL series.
I'm so upset right now.
Sorry. I understand. And there's sigmoidoscopy. The procedure to look inside the rectum and sigmoid, the lower colon, for small pieces of bulging tissue, abnormal areas, or cancer. The sigmoscope is inserted into your rectum and into the sigmoid colon. The sigmoidoscope is a thin tube-like instrument with a light with no environment or viewing. It's like a little probe. It may also have a tool that removes polyps or tissue samples which are checked under a microscope for signs of cancer. A colonoscopy, a procedure to look inside the rectum for colon or polyps, abnormal areas, or cancer. The colonoscope is inserted through the rectum into the colon and also have a tool to remove polyps or tissue samples which are checked under a microscope for signs of cancer. The biopsy, the removal of cells or tissues so they can be viewed under the microscope by a pathologist to check for signs of cancer. A virtual colposcopy, the procedure that uses a series of x-rays called computed tomography to make a series of pictures of the colon. The computer puts these pictures together to create detailed images that may show the polyps and anything else that stands out inside the surface of the colon. The test is usually called a colonoscopy or a CT colonoscopy. And the only treatment that you can go through right now is surgery or chemotherapy, radiation therapy, or cardiotherapy. So I'm gonna let you and your family decide what you like to do. But I recommend that you try to get this taken care of as soon as possible. So it doesn't get any worse. Alright?
Yeah, thank you.
Yep.
Oh, hi, Andrey.
Hey, doctor.
Bad news for you, Andrey. You have cancer. Do you know what cancer is?
No, could you explain it to me?
Cancer is a cluster of more than 100 diverse infections caused by smoking or tanning beds. Have you been smoking lately?
No, I haven't.
Have you been tanning?
No, I guess I'm just unlucky.
Well, cancer can be passed through your parents, down through your parents. Yeah, so you can blame them if you want to. Just don't blame
There's no one
me.
to blame. No.
Well, I'm gonna leave you with this, because I feel like you have to think a little bit. Have fun with that, Andrey. I will see you tomorrow.
Thanks, doctor.
So remember 7 early warning signs of cancer. It spells out the word caution. So for C, it's change in bowel or bladder habits. A stands for a sore that does not heal. U stands for unusual bleeding or discharge. T stands for thickening or lump in the breast, testicles, or elsewhere. I stands for indigestion of or difficulty swallowing. O stands for obvious change in the size, color, shape, or thickness of a wart, mole, or mouth sore. N stands for nagging, cough, or hoarseness. And the following symptoms may also signal the presence of some form of cancer: persistent headaches, unexplained loss of weight or appetite, chronic pain in bones or other areas of the body, persistent fatigue, nausea, or vomiting, persistent low-grade fever, either constant or intermittent, and repeated instances of infection. So, in what ways can smoking cause lung cancer?
Smoking definitely plays a role in lung cancer, just because tobacco smoke has carcinogens in it, which are cancer-causing agents. I think it's pretty common knowledge, but the issue with smoking is that generally when people smoke, and become addicted, then just the intake of so much smoke throughout their lifespan is going to attribute to them obtaining lung cancer. There's other professions which even people who have exposure to inhaling some type of carcinogen where they're at higher risk for having lung cancer, like a firefighter or people that work in coal mines. It's just because they're constantly inhaling just bad quality air. So the way that smoking plays a role into it is that it's just because there's cancer-causing agents in there and people are addicted and they can't stop. Therefore, a lot of smokers get lung cancer. The good news is that if you were to quit smoking, probably within a 7-year time frame after the date that you quit, your lungs actually return to a state where it didn't look like you were a smoker at all. So, in a way, if you quit smoking, some of the damage can be reversed. So, that's it on smoking.
So, Mr. Reyes, how can tanning beds cause cancer?
Tanning beds can cause cancer. I'll say this about tanning beds. The way that they work is that you're being exposed to I believe it's ultraviolet light at a very concentrated form compared to just the regular sun. So then what's happening is that when you're tanning, I think the maximum time they allow you to tan is probably like 10 minutes at a time. You're receiving a really concentrated dose of UV light. That concentrated dose of UV light in such a short time span is actually a lot more intense. It could be more detrimental to your skin rather than just having like 2 hours out in the sun, where the intensity of the UV light isn't as much. And that's why there's always a risk, because like when people go into tanning beds or those stand-up booths, a lot of them are going to burn right away within a 10-minute time frame. And whenever you burn, it always puts you at higher risk for getting skin cancer.
So, what nutritious ways can you eat to stay healthy if you have cancer?
You definitely want to have a diet that is just it's like the stuff that your health teacher's been telling you about. You want to make sure that the bulk of your diet comes from foods that are rich in antioxidants. Antioxidants are found in foods which help get rid of free radicals in the body. Free radicals in the body are like toxins which float around in your circulatory system, which actually cause cancer. So whenever you have a diet that's high in antioxidants, what happens is it attaches itself to those free radicals and it helps you remove the body when you go to remove those detrimental toxins every time you go to the washer. So an example of an antioxidant-rich food would be something like blueberries, a lot of green leafy vegetables. Broccoli is known for it. Just generally stuff that comes from good produce, good quality vegetables, and good quality fruits. That's generally where you're going to find your antioxidants. And that can generally reduce your risk of